So really for almost 5 years now, we've had single-agent checkpoint inhibitors available in lung cancer use. We know that combinations with other drugs like CTLA-4 antibodies, specifically a combination of nivolumab and ipilimumab, has looked active in many tumor settings, including non-small cell lung cancer. In fact, there's an FDA label for advanced renal cell carcinoma, for advanced melanoma, and actually MSI colorectal cancer. CheckMate-227 was a study to look at that regimen in first-line patients who could have been randomized to also receive chemotherapy, platinum doublet chemotherapy, or platinum doublet chemotherapy with nivolumab. There actually was not an arm to look at nivolumab alone because we have data from an older study, CheckMate-26, that showed nivolumab doesn't really have a role as monotherapy. A complicated study. We've seen many versions of it. It's an interesting and complicated design with several endpoints. Suffice it to say, at this meeting, ESMO 2019, we've gotten to see that the study hit one of its main endpoints, which is nivolumab and ipilimumab improved overall survival compared with chemotherapy, platinum doublet chemotherapy, in patients who are PD-L1 1+ or higher. So that's a major finding because we've been waiting on survival results. It does not include TMB, tumor mutation burden. I would suspect this will get a label for nivolumab, ipilimumab, or an expansion of its label now in first-line non-small cell lung cancer in PD-L1 positive patients. One interesting finding from this study, not enough, I think, for a label, is in the zeros, because they were on this trial. The zeros who got nivo-ipi, they had a substantial survival advantage over chemotherapy. And so that's an interesting group that you'd wonder about. Nivo-ipi's perfect for the zeros, the zero expressors, but that's not likely what the label is going to include. So we'll have to see how that plays out in terms of common use and ability to give that regimen.